Hello and welcome to Talk Trillium, Partnering for Patients. I'm Patti Cochrane, Senior Vice President and Chief Innovation Officer at Trillium Health Partners, which includes the Credit Valley Hospital, Mississauga Hospital, and the Queensway Health Centre. I'm your host at Talk Trillium as we take a look at the work our hospital is doing to create a new kind of healthcare for a healthier community. Today, we'll be talking about cancer, the programs and services that we offer across all three of our sites, and how we partner with our patients through their cancer journey. I'd like to introduce our guests today, both experts in cancer care and treatment. Dr. Craik McFadyen, he's got quite a title. He's the Vice President of the Cancer Program at Trillium Health Partners. He's the Chief and Medical Director of the Cancer Program, as well as the Regional Vice President with Cancer Care Ontario. So welcome, Craik.
Thank you, Patti.
And Sarah Etheridge, who is our Regional Director of the Cancer Program.
Thank you, Patti.
So maybe over to you, Craik, for our first question. As the Regional Vice President with Cancer Care Ontario, can you talk a little bit more about the partnership with Cancer Care Ontario and how it benefits our patients?
So in 2004, the province was split into 14 cancer programs. And they're governed, so to speak, by Cancer Care Ontario, which is an arm's length relationship with the Minister of Health and Long-Term Care. Each program is roughly attributed to the size of the LHIN, and each LHIN, or each program, has a regional cancer center.
So when we talk about the LHIN for our area, that would include Mississauga, Halton, and a small part of Etobicoke, just for our viewers.
Right. So we are the exception to the rule in the province of Ontario, where our regional cancer program actually covers the Central West LHIN and the Mississauga-Halton LHIN.
So that includes Brampton then as well?
It does, yes. So
right.
The regional cancer program, the regional cancer center is at the Credit Valley site of Trillium Health Partners, and our partnerships are with the William Osler Health System, the Halton Health System, and Headwaters Hospital in Orangeville.
So can you explain to us how Cancer Care Ontario helps patients through their journey in cancer, or set standards perhaps in care?
So Cancer Care Ontario has spent a long time establishing an evidence-based program and disease pathway management with the goal that patients, no matter where they live in a province, and for our region, or where they live in the region, will have equitable, evidence-based, effective care. And one of Cancer Care's other priorities is to make sure that everyone has equitable access. So access and quality of care are two primary motivators behind the Cancer Care Ontario theme.
That's a wonderful program, I think, for our patients in Ontario. So can you tell me, how do we know we're doing a good job in access and quality? You know, I'm familiar with getting a report card in school, and it kind of tells me a little bit about how well I'm doing. Is there that kind of system for us? Cancer
Care Ontario is a highly metric or measurement-driven system. And each regional cancer program on a quarterly basis is evaluated on 14 different parameters as to how well they're doing, and compared with all of the other programs within the province. So these measures, or these scores, are related not only to access but to quality. So we look at wait times for surgery, radiation, and medical therapy, how well we're doing on screening, how well the data that we're actually submitting for measurement is, and so forth. The Mississauga-Halton Central West Regional Cancer Program, again, of which Trillium Health Partners is the administrative epicenter, has fared very well on that report card, and in the final quarter of 2013-14 actually finished second out of the 14 programs in the province. That's wonderful. So it's great for our viewers to know that the services that they receive are being measured and benchmarked, and we are actually performing very, very well. That's great. Thank you. That's great. So maybe switching to another topic that might be of interest to our viewers, can you tell us a little bit more about the most common types of cancer that we find? So the most common types of cancer that we find in Canada, and in fact in North America, are prostate cancer, breast cancer, lung cancer, uterine cancer, and colorectal cancer. Those are the 5 major cancers that we find within Canada. Skin cancer, of course, is a very ubiquitous cancer, and unfortunately getting even more common, especially melanoma. So it would also be included. We tend to talk about the 6 leading cancers now. Oh, great.
So Sarah, maybe you could talk to us a little bit more about supporting patients across their journey, their cancer journey. Once a patient is diagnosed, what kind of supports do we provide for these patients?
So we have many supports. We have a large healthcare team that looks after the patient throughout their journey. We have an opportunity with respect to the diagnostic assessment programs for rapid diagnosis and support using nurse navigators through that part of the patient's journey. And then once the patients are referred to the cancer program, then we have primary care nurses who will see the patient with their physician on the first visit and who will be the point of contact for those patients throughout that part of the journey. Depending on the type of cancer and the treatment that the patients need, there may be several handoffs between healthcare providers, but because we all work in the same system with respect to the patient chart, that access to that information is always there for those patients. So whether the patient's coming to see the physician or whether they're going through for chemotherapy treatment or radiation therapy treatment, we have a strong team of professionals that are there to support the patients. We also have a strong team of support, allied health professionals, social workers, dietitians, as well as spiritual care and psychology who can also provide that support to the patients.
So it sounds like the support is there even before diagnosis and definitely after diagnosis. So you mentioned something about the rapid assessment centers. Can you just tell us a little bit more about them and how they were created?
So the diagnostic assessment programs were a project initiative that came from Cancer Care Ontario to provide that rapid access into the system through diagnosis and, if necessary, for the treatment of cancers. Specifically, they started with the breast diagnostic assessment program. So those patients come in with a mammogram that may be suspicious of a breast cancer diagnosis. They see a breast cancer surgeon. They have access, as I mentioned, to the nurse navigator and any of the psychosocial oncology support that they may need. And if the suspicion is proven to be a cancer, they will then be followed up with their surgeon, have the surgery, and then go on to the cancer centre.
So it sounds like you've removed some of those sleepless nights of anxiety by fast-tracking that whole process through these types of centres. That's wonderful. You know, we've gone out to our community to ask questions what they might have, and so why don't we take a look at what question they might have for us.
Hi, I'm Thomas Walker, and I was actually wondering, would there be any way for me to reduce my risk of actually getting cancer?
Wow, what a great question. I'm sure everybody's interested to know how to reduce their risk for developing cancer. Any thoughts, Craig?
There are several ways that an individual can reduce the risk of getting cancer. The first and probably most commonly known is cessation of smoking. So smoking is clearly the most important cause of lung cancer, which unfortunately is one of the most common cancers in North America and the most lethal cancer that we face nowadays. The cessation of smoking starts to reduce your risk of cancer within 1 year of the stopping of smoking. So smoking is a major carcinogen we find in our environment. It's not only related to lung cancer, but it's also related to oral cancer or cancer within the mouth, esophageal cancer, and bladder cancer, and kidney cancer. So there are many cancers that are specifically related to smoking. The other thing is diet. Colorectal cancer, which is a very common cancer in North America and Western Europe, is not common in cultures in which the diet consists of higher fiber and lower saturated fats. So there's clearly a link between causation of colon cancer and the type of diet we tend to eat in well-developed countries. The third one is weight. We know that cancer, unfortunately, has a higher incidence when people are outside their ideal weight. The cutoff is generally thought to be about 20% outside your ideal weight, but excessive weight gain is clearly associated with some cancers, including, unfortunately, breast cancer. The final, not the comprehensive list, but the final important thing that people can do is to pay attention to the sun. You know, melanoma is a very, very serious disease, and simply observing some precautions, hats, shirts, good sunblocks can certainly reduce your risk of getting skin cancer. It is believed that if you have 2 significant sunburns, especially in your younger years, you double your risk of getting melanoma later in life.
So Craig, it sounds like great advice. A lot of it seems like common sense. So unfortunately, you've mentioned staying out of the sun. You've mentioned something around diet, and I think in a previous show we talked about alcohol and coffee, so we just add the diet to the list. Keeping our weight in check, so that's always something that we need to be mindful of. And I think the first one was around smoking. And so I think that makes a whole lot of sense, and I think most of our viewers have control of most of those factors. Unfortunately, it's hard to do sometimes.
The other thing that people would be surprised to know, and there's fairly good science on this, that people who are physically fit, people who are physically active, have a decreased risk of developing cancer later in life. So just generally good lifestyle habits clearly reduce, we feel fairly confident, reduce your risk of getting cancer later in life.
Great. Now we just have a minute and a half left in our show today, and I understand we have new linear accelerators. Can you tell us a little bit more about that?
So yes, we in the last few months we've actually had a couple of our radiation treatment machines replaced. They're called linear accelerators, and we are fortunate at Trillium Health Partners to have the new generation of linear accelerator. We have 2 of them currently, and we're expecting a 3rd within the next 9 months. We will be the only first cancer centre in the province to have 3 of these true beam linear accelerators. The way that some of the features are within the linear accelerator allows us to treat patients with cancer with a much more sharply focused beam with much rapid decrease of dose to the surrounding tissues. So we're able to treat the area of interest to a much higher dose while limiting the dose to the surrounding structures.
So it sounds like that's got benefit for patients. Can you describe what the benefits are for patients a little bit?
Certainly. We at Trillium Health Partners, we have started a new program of what we call high precision radiation therapy, which includes what's known as stereotactic radiotherapy, stereotactic radiosurgery, and it allows us to focus the radiation treatment beam to a smaller area, provide that sharp edged affinity to the lesion, and as well be able to vary that intensity across the treatment area and limit the dose to the normal structures. So patients will have reduced side effects from the treatment, but also we hope a better outcome at the end of that.
That's great. So less injury to normal tissue, it sounds like,
yes,
and the better ability to go after those cancer cells.
Yes.
I want to thank you both for joining us for this segment of Talk Trillium, and we'll be back after a short break for more information on cancer programs. Welcome back to Talk Trillium, Partnering for Patients. I'm Patti Cochrane, your host from Trillium Health Partners, and today we've been talking about cancer. We have been talking to Dr. Craik McFadyen, and now I'd like to introduce his colleague, Maria Rugg. Maria is the Manager of Supportive Care and Psychosocial Oncology. That's quite a long title, Maria.
Yes, yes.
Can you tell us what you do?
So I think the crux of it is really just trying to look at what else can we do beyond the medical care and look at support and emotional, physical, emotional, psychological support for patients and programs that'll help the patient and their family members connect throughout their cancer journey with things that can help them see their way through.
So it sounds like your role actually supports the treatment of patients holistically.
Yes.
As well, not just the patient and their cancer, but them as an individual and their families. And so maybe I'll ask you, Craik, or Dr. McFadyen, how you operate under this values proposition.
As a surgeon, I'm frequently the first person to tell a patient or an individual that they have cancer. I've usually done an operation or a biopsy, and so sometime I'm the one breaking the news. And I know that I've told them something that is going to change their life. People get this disease in a context of their life, of their family life, of their social life, of their religious life, of all of the people around them. And what we want to make clear to people who come to us is that we're not only going to treat your cancer, we're not only going to treat your tumor, but we're going to treat you as an individual. We're going to find a way to tailor your treatment so it fulfills the goals that you want to get out of it. And we're going to pay very, very close attention to your emotional, faith-based and psychological needs as we move you through this process. So to us, we understand that cancer is very personal. It frequently doesn't just happen to a patient, but it happens to the family and their circle of friends. And we want people to know that in addition to just giving you the therapies, we're going to pay very, very close attention in terms of supporting you through this journey.
That's very comforting to know. So what are some of the social and emotional challenges that an individual faces when they receive a cancer diagnosis?
Well, I think some of those things, again, if you look at the life, anyone's life, financial issues come about because, you know, employment gets impacted, interaction with family members, you know, the cancer touches everyone at can touch anyone at any stage of life. So issues around how to talk to my children, how to talk to other family members, trying to look at oneself, and for many people, most people, that diagnosis begins all sorts of thoughts about what does this mean to me, who I am as an individual, you know, where am I going to get the help that I need, where am I going to find it in the community that I live, how am I going to talk to my neighbor, or, you know, the people within the circle. And so it impacts in all different levels. As a man, as a woman, as a young adult, as a middle adult, as an older adult, all through the life cycle, there are different challenges, different issues. And so what I think we try to do is try to ensure that what we are looking at is really, as Craig was saying, those issues of, it's personal, it's very personal, and therefore the whole patient and the whole family needs to be looked at as a whole.
When can I drive? When can I go back to work? Can I travel? How do I tell my friends? How do I tell my partner? How do I deal with that relationship? These are all things that are really, really important to patients.
You know, I think most of our viewers would think that our hospitals do surgery, they know that we have an emergency department, they know that we have hospital beds, but to think that we have programs and services to really offer emotional support and social support is great news. Can you describe some of the programs that you have in place to support individuals and their families?
Yeah, Patty, I think what we try to do, again, we look at the whole journey. So we talk about some of those programs that we look at are both self-directed and also supportive, so in a group or one-to-one. So some of them we talk about patient education. So we have self-management classes teaching people how to cope with anxiety. Anxiety is normal. It's something that we expect to happen. So we have things around being able to come and learn how to manage your anxiety, not just with a professional, but how to help yourself manage your anxiety. For certain diagnoses, breathing is an issue. So we have, versus just using medication, we try to bring in all sorts of things to help manage that. Managing your diet. Diet is an important piece, not just of the cancer journey, but just, you know, taking good care of yourself. So we have programs that are run by dietitians around how to manage your nutrition, not just during treatment, but also to prepare yourself for treatment and post-treatment. We also have programs that look at different things after, what happens after treatment's finished. Where do I go? What do I do? You know, what's next? This has changed me as an individual, changed my family. So we have a really robust, what we call survivorship program, where we look at how do we connect you with each other back into the community, but also, you know, there are things after treatment's over. So we try to look at all aspects of the cancer journey, all aspects of the person and the programs that we offer, so that they're therapeutic, but they're meaning they offer therapy, but they also offer ways that I can teach myself how to get myself through this.
That's great. So we have another question coming from our community. Let's take a look and see what they have to ask us.
Hello, I'm Yvonne. I have a question. Like, people always talking about the importance of like positive attitude if you or your friends are diagnosed with cancer. So what I would like to know is what exactly is positive attitude, what we can do in order to get this positive attitude. Thank you.
Well, that's a great question. Positive attitude. I think that that's true for all of us. So can you speak a little bit more about positive attitude?
I think what I hear from patients and what I hear from from their caregivers and professionals, it's really about coming into this with an idea that it's part of who I am, and it's not just, I'm not just the tumor or the treatment, but I'm me. And so therefore, I as the individual am someone that can get through this, right? And so what we try to do in terms of promoting that idea of a positive attitude, as I said, for example, the anxiety. Anxiety is normal. We expect that. We know that's going to be part of it. So what we try to do with families and patients going through this diagnosis is say, this is normal. How do we make it, normalize it, and help you get through it? So that idea of a positive attitude isn't just about not being able to cope, but it's also about, you know what, this is good, I'm going to get through this, and I have people to help me. So
very strongly agree. This is very, very difficult to do. I'm not saying this is easy to do, but we try to encourage patients not to allow themselves to be defined by their cancer. It's a word, it's not a sentence. And I personally also try to encourage my patients to be a little bit self-indulgent. Be kind to yourself. Eat well. Sleep well. Accept the help that your friends are giving you and your support structures are giving you. This is a very difficult time for you. You will feel that you want to try and control everything, but unfortunately there are things that you won't have complete control over, although we'll help you to the best of our abilities to get you through what's about to happen to you. So I think that attitude going in is extremely important.
You talked a little bit about self-indulgent. I know there's a program called Look Good, Feel Better. Can you describe that program and what it offers patients?
It's a program, it's a collaborative program, so meaning that we work together with our community partner. It's an association of in the cosmetic industry. And what they go about is, it's about the idea of the positive attitude. Treatment can change the physical appearance, and it's primarily directed at women. And it really looks at that idea of, you know, despite what may change physically for me, I can still feel good about it. So they give skills. So it's an opportunity to come together as a group. So they host sessions every 2 weeks. Right within the hospital, in the cancer program, we have a room called the Look Good, Feel Better room, where they have mannequins. They help people with how to do their wigs, and if they want to wear wigs, how to do scarves if they don't want to wear a wig but they want to wear scarves. They get access to fragrances and cosmetics. If you know, that's something, they get an opportunity to have a demonstration and be demonstrated upon. But it's more about that opportunity to share each other's stories and know that I'm not alone through this. And so we work with the industry to help support a space for them and be able to let patients know. So we let patients know when the sessions are running, and they can sign up and kind of walk in whenever they decide they want to.
So it's great to know that within the walls of a hospital, we're not, again, just doing major surgeries.
No.
We actually have some soft spaces for patients to look good, feel better along their cancer journey.
Absolutely.
Now, I know another way of reducing anxiety is by teaching patients, and I think you've got something called a chemo class. Can you describe that a little bit in 1 minute or less?
Yes. So the chemo class is really about trying to understand that treatment and how it impacts not just on the physical self, but also on the emotional self. So there are kind of two parts to it, and it's done by healthcare professionals, pharmacy, nursing, social work, psychology, and they really talk about what medications you will take, where. They give an environmental kind of tour, and then they also talk about the emotional journey that you will go through, what it's like to get the diagnosis, and kind of normal emotions you will feel all along the way. So they give you an opportunity to understand all the different aspects, and really helps the patient who's going through chemo to understand that whole process. And they're really much encouraged to dialogue with each other, as well as bring family members, so they get a chance to really understand not just the pieces of what's going to happen to me, but also how to navigate through.
That's great. So Dr. McFadyen, we've got 30 seconds left. Any last words of advice for our viewers?
Cancer is a very, very difficult thing to hear. But there are many, many, many things that we at Trillium Health Partners will bring to bear upon your treatment and your psychological and emotional health. There are many things that we can do. So although it's a devastating word to hear, we have a lot of arrows in our quiver.
Wonderful. Thank you for joining us both today, and stay tuned as we take a short break. Welcome back to Talk Trillium, Partnering for Patients. I'm your host, PATTI Cochrane, and today we're talking about cancer care. We've been speaking with Maria Rugg, and right now I'd like to introduce two more guests from our Patient and Family Advisory Council, Ricci Charette and Kayle McMillen. So maybe, Maria, you can talk to us a little bit about why you were motivated to start a Patient and Family Advisory Council.
So I think part of it is just being in clinical care and having done clinical work with patients and families. The best person to talk about their experience is the patient and family. So we really wanted to do the work that we've seen at Cancer Care Ontario, kind of our governing agency, who have a provincial patient and family advisory council, and we wanted to get it something that was regional for Mississauga, Halton, Central West. So the idea there is to have patients and families helping right from the get-go, helping shape and form their experience within the cancer journey, and what better way but to have a council that helps us look at care.
So it sounds like we're trying to hear the voices of patients as they've been through the journey to help us improve and continuously improve, I guess, on that journey.
Yeah, absolutely. And I think it's about hearing their voices, but even going beyond that, actually having their experience and helping them shape the experience for those who are to come as well.
So who sits on the council and how big is it?
So we have both active patients, patients who finish treatment, as well as family members. We also have staff members sit on the council. There's about 20 to 25 people, and the co-chairs of the council are actual patients themselves who have been treated across our region, which is Mississauga, Halton, Central West. So they may have been treated either at the Credit Valley site, or at the Queensway site, or at the Mississauga site, or at William Osler, or in Halton as well. So they bring different experiences, different site groups, diagnosis. Some are at varying degrees of treatment or completed treatment.
Thank you. Ricci, it's really a pleasure to have you join us this morning. Can you tell us a little bit about why it's so important for you to sit on this council?
Absolutely. To me, it's an absolute honor to be able to have an opportunity to not only share my own personal journey, but to also be a representative for the voice of the we. And that's what I'm really looking forward to as we are learning and growing through this, getting this together, is realizing that what we do really does impact the outcome of what the care is, not just for myself, but for other cancer patients as well. And I can tell you I've already felt my own care improve, which is just a small part of the motivation behind being a participant on this. And of course it's about the bigger picture, about making it better for everyone.
So it sounds like you are on a cancer journey yourself personally.
Yes. And
how did you get involved then with the council?
Well, by being very open with my doctors and communicating and advocating for myself that I believe that it's important to treat the entire patient and not just the obvious disease. And I am a big advocate for the mental health as well. So reaching out to my doctors and asking for help with that, there was a few other stepping stones in the way, but that definitely led me to Maria and this board, and I couldn't be more honored and more proud to be a part of it.
So Karen, you mentioned, or sorry, Ricci, you mentioned that you've already noticed a little bit of improvement through the services and by participating in the council. Can you describe that a little bit?
Absolutely. Through a lot of it is actually through patient education. So the healthcare system can be very intimidating, and especially whenever you're first diagnosed, because you're scared out of your mind. You don't know what's going to happen. The big C is there. It comes with all kinds of negative stereotypes, and when you open up that door to communication to your doctor, not only do you start to break down that wall of fear, but that's actually how you can start getting individualized care, where your doctor can mold to what you specifically need, because my cancer is different than your cancer, it's different from everybody else's cancer. So the only way to achieve that individualized care like that is to break down those barriers of communication, figure out how to do that. So taking a couple of classes, like for instance the coping clinic, it gives you so many skills on how to better communicate, not only with your healthcare team but also with your family, your partners. You get guided in really through every step at that point, and then you realize that going through cancer doesn't have to be an ugly, horrible thing. It can actually be beautiful, uplifting, life meaningful. And I'm sorry, I'm going to get a little emotional on you here. But
well, it's good to know that you've taken advantage of some of the services that are offered. The coping clinic allows you to give you the skills that you need to be able to better voice what you need with your doctor.
Yes, and Maria will tell you that, I volunteer for everything, and you don't even have to. Even just the ones that are geared towards your interest are going to help you, because it is for you, and they're designed in a broad spectrum, so then hopefully there's something from each one that you're going to benefit from. And the best analogy I could possibly give is if you were walking through a door and the door had the word cancer written over it, and as you're walking through, you go in as one person, and on the other side of the door you're completely and totally someone else. And that's how you can look at something that seems so horrible but yet turn it into something incredibly beautiful.
Thank you, Ricci, for sharing that. Now, maybe we can ask you, Karen, about your personal reasons for joining the council.
I got the invitation to join the council, and I was very open to explaining my journey and how my journey was quite positive experience, and I wanted to be that voice of positivity into the council, because so many people join the councils or committees like this, and all they want to do is complain. We did this wrong, we did that wrong. I wanted to be the voice of, but look at all the things that we're doing right. I thought that was very important, to be that positive voice.
So it sounds also like you've had a personal experience with cancer as well.
I have, yeah. And I have more to come.
Okay, thank you. So we have a question from our community. Why don't we take a look and see what they want to ask our viewers, or ask our panelists.
I have a loved one who's diagnosed with cancer. What can I do to support them?
So we've talked a lot about the support of patients through this journey, but what about their family members and their caregivers? Maria, can you respond to that question?
Sure. I think what we need to remember always, and what we try to do with our programs, is help patients and their family members, and supporting them really means recognizing that while it may be their mother, their father, or whoever is going through cancer, they are also going through it from a different lens. So I think the best way to support them is to be able to offer things to them that they can help recognize their own experience, individualize their experience, because it may be very different than their loved one who's actually going through it. So we give them the opportunity, the best thing to do is give them the opportunity to have a voice and to be able to describe their journey. You know, making sure that we're attentive and we ask them how they're doing, how are they coping, how are they feeling, separate than how their loved one who's going through it is feeling. I think that's the best way is as Ricci was talking about, opening up that communication and recognizing that it's the whole family that's involved.
So, Ricci or Karen, any advice that you can give to family members who are supporting loved ones through a cancer journey? What worked for you?
I would say the best thing the family members can do would be to just be there, to ask them how are they feeling. And the first time I had cancer, my children were fairly small, so they still expected me to be mommy, and I couldn't always be mommy. There were times when they needed to cope on their own for a day or so, particularly just after having a treatment. So it was just to be understanding and to be there to do whatever the patient needed. But as Maria said, particularly for children, it's very important that their voices are heard as well.
And Ricci?
Good point. I think exactly what she said. The importance is you're there. First of all, just to be there, listen, but also don't be afraid to speak up for yourself when you need help. Because, you know, as a cancer patient, I can tell you, I worry about whether or not my kids are reaching out when they need help. I worry about whether or not my husband is seeking support when he needs support. So don't be afraid to ask for support, because in taking care of yourself, you're also going to help take care of the patient you're trying to support. So you have to learn how to balance it. It's tough, but it's doable.
And is there any advice you could give to anyone newly diagnosed with cancer that you'd like to share?
Don't be afraid. And I know that sounds horrible, because obviously everybody is going to be afraid at first, but you're more in the driver's seat than you think. I think that's one of the things that I would tell them. And you know, just take it one step at a time and ask as many questions as possible. Really, that's, if you start with asking questions, that communication and everything else will come.
I personally found that information was key. When I didn't know what was coming, I was scared. When I first got diagnosed with cancer, I went online, made sure I went to a reputable website, didn't go to one that was not based from the medical community, and I researched my cancer and found out a lot of things that I didn't know. So I went to my oncologist with a list of questions, and I took a family member with me. That's very important when you're in the early stages and you're scared and you don't know what's coming and you're really not listening to the answers to your questions. Yes, you go with the questions, but you need somebody to be there to remind you what the answer was.
So don't go it alone.
Don't go it alone.
Ask lots of questions. That's some really good advice. And to know that there's lots of programs and services available for you to help you develop some coping skills and other types of skills as you go through this journey. I just want to say thank you on behalf of Rogers and Trillium Health Partners for sharing a very personal journey with our viewers and hopefully supporting some of them. And thank you, Maria, for all that you do.
Thank you.
So we're just going to take a short break right now. We'll be back to talk about screening. So stay tuned. Welcome back to Talk Trillium, Partnering for Patients. I am Patti Cochrane, and today we're talking about cancer services. I'm really pleased that Ray Applebaum, CEO of Peel Senior Link, has joined me as our co-host today. So welcome.
Thank you. Thanks, Patti. It's great to be here.
Great. I'd also like to introduce our two guests who are going to talk about cancer screening. First, we have Jane Craik. She's the interim manager of the Integrated Cancer Screening. And next to her is Kayle McMillen, Health Promotions Coordinator. So Jane, can you tell me a little bit about why you're so passionate about making sure everybody gets screened for cancer?
Oh, it's so important to be screened for cancer. The purpose of screening for cancer is to find cancer early or to even find changes before they become cancer. So, and we know that if we find cancer in the early stages, that there are more opportunities for treatment options, and it may even impact the outcome. For example, if colorectal cancer is found early, it's 90% curable. So cancer screening is really important for all of our citizens.
Yes, my mother actually experienced that, and we were all advised to get screened for colorectal cancer because it can be within the family.
Correct.
Yes, so it's really important to catch it early. So you might even consider it, the prevention part is part of that cancer journey.
So prevention is really important through healthy living, healthy eating, not smoking, but cancer screening is also part of that preventative program, and also early detection.
Great.
Very important.
Jane, what types of cancer can you screen for?
So there are 3 organized screening programs in Ontario. There's the Ontario Cancer Screening Program. There is the cervical cancer screening program and the colorectal screening program.
Okay, thank you.
So in terms of cervical cancer, have the guidelines changed recently?
Yes, actually. The cervical screening program is for women that are 21 years of age and have ever been or currently are in a sexually active relationship. And they used to be once a year that a PAP test was recommended, but it's now every 3 years. The reason for that is that we know cervical cancer is a very slow-growing cancer, and 3 years is an adequate screening period in order to find cancer at its early stages.
In terms of breast cancer, what about screening males for breast cancer?
Well, the Ontario breast screening program is for women, so men aren't included, but that doesn't mean that men don't get cancer, but it's not very frequent. So if there's a family history or a family physician feels that a male should be screened, then that is absolutely at their discretion, but it's not part of an organized screening program for men.
And in terms of colorectal cancer, how would someone know if they're at a higher risk of developing colorectal cancer or any cancer per se?
Do you want to take that one?
So with colorectal cancer, the majority of people are just at average risk and have to be screened with average guidelines. So that would be all men and women. So it's the only screening program available for men. And that would be between the ages of 50 and 74 through a test called the FOBT test, which is the fecal occult blood test. It's a really easy take-home test, and you do a couple stool samples over a couple days, send it in an envelope, and they'll send the results back to you and to your doctor. For high risk, you can definitely talk to your doctor about if you're at high risk for colorectal cancer or any other type of cancer, whether it's through lifestyle factors or family history, and see if you need to be screened earlier or more often.
You know, in the community sector where I work every day, we see a lot of people who often that would benefit from screening. And my question is, what are some of the reasons people don't get screened for cancer?
There are actually a lot of reasons that people don't get screened for cancer, that it might be more difficult for people to get screened. It can be a lack of education and a lack of awareness. So even, especially if someone has a language barrier, that might make it more difficult. Things like beliefs or fears or misconceptions, which could either be cultural or they could be personally based. For example, there's a common misconception in some communities that if you screen or if you breastfeed your children, that you don't need to be screened for breast cancer. And we know that that's inaccurate, and that everyone or all women need to be screened between the ages of 50 and 74.
Right.
Another barrier is actually the health system and accessing different services. So making sure that people have services available in the languages that they speak, as well as have access to a primary care provider, a family doctor that can help guide them through the process.
So Kayle, you're a health promotions coordinator.
Yes.
And so how do you ensure that everybody knows about the screening programs? How do you ensure that it gets out there?
We have a lot of programs that are out in the community right now that are really looking at trying to address some of those barriers that we just talked about, as well as really targeting different communities that we know have lower screening participation rates. So in our region, we know that South Asian, new immigrant, and low-income communities tend to have lower screening rates compared with the general population. So we have a number of different programs that really outreach to those communities. We have one program that we aligned with the Canadian Cancer Society with, their Screening Saves Lives program, and we developed a complementary program called Screen Easy. And Screen Easy is really trying to take it past that next step of education and really help to support individuals in getting screened for cancer. So it's a navigation support system over the phone where people can call in and we can answer any questions. If they don't have a family doctor, we can help them find a family doctor in their region, as well as we can help them actually book screening appointments, whether that's with an Ontario breast cancer screening site or with their primary care provider. Some of the other programs that we have are, one is called Your Health Matters, which is a workplace health program where we go into different workplaces and do presentations on cancer prevention and screening for the employees. We also do a number of different media campaigns. We just finished one up that was advertisements and interviews on a South Asian radio program. And we're always out in the community doing events to really reach out to those communities that we're trying to reach, either through places of worship or ethnic grocery stores, settlement services, language instruction classes, and other community events that are going on.
So if some of our viewers, they've just heard about these programs, how would they actually access these services? And is there a charge for those services?
So there's no charge for any of the services, which is really, really great. The Screen Easy program that I talked about, you can just call the number 905-813-4220, and we'll have a navigator there that can talk you through, answer any of your questions. She speaks a number of different languages, and we have translation services. As well, you can go onto our website, which is the Regional Cancer Program website, www.mhcwcancer.ca, and Cancer Care Ontario's website also has a number of different resources and information there for people.
That's great. So you gave us some good information there, and for the viewers that want more information, they can also go to the trilliumhealthpartners.ca website, and we'll have all the information from these shows. So thanks for sharing that information.
My question is just to understand the referral process, that you do not require a referral, therefore, to the program?
For the Screen Easy program?
For the Screen Easy.
There are a number of different ways that we actually get people in. So we're doing different public education initiatives in the community, and either we can give our phone number out and leave it up to the individual to call us when they feel comfortable, or pass that information on to a friend or family. As well, we have some referral cards. So if we can, we like to get the information right from the individual on the spot and get their consent that we can contact them. So it's just a quick fill out their name and number and a little bit of information, and then we'll have someone contact you right away.
That's really excellent, because we know that access and information are really key for people to take that first step and the awareness side of it. So that's really great to hear that your program has no barriers from that perspective.
Here's a question for Jane. I'm wondering if one of the barriers is that people are afraid of the results that they might get when they go for screening. So can you give any advice around anxieties, or how do we allay anxieties for people that are about to go for screening?
So it is a frightening concept to think about screening for cancer. I think one thing is to understand exactly what the screening is about, so exactly what's going to happen when you go for the screening. You know, for breast cancer, it's a mammogram, which is an X-ray of the breasts.
How often should individuals go for a mammogram?
So for women between the ages of 50 and 74, they should go every 2 years.
Okay.
And actually that program you don't require a referral from primary care, so a woman can walk in and receive that screening. For the cervical cancer, they examine some cells from the opening of the womb under a microscope to look for any changes. That should be done every 3 years. And for the colorectal program, a stool sample should be examined every 2 years as well. So I think if you understand what it is is that you're going to be doing that helps to allay some anxiety. But I think also to understand that catching cancer early or before it even starts is a much better process than treating cancer later on.
Yes.
So
Yeah,
it's better to go in.
I know that I had 2 experiences in my life many years ago, and fortunately they were benign, but it was early detection that really was the thing that saved me in terms of getting in and getting that done.
Yes, yes, yeah.
Any last pieces of advice for our viewers?
It's really, really important to go for screening for the 3 different programs. Please, if you have any questions, feel free to reach out to us on the Screen Easy hotline. We can guide you and help you find the services that you need, but it's really important.
That's great.
And Kayle?
Yeah, I would echo Jane's comments as well. Just it's better to get screened and get all of the information, because when we can detect it early, we can either prevent it altogether or detect it early enough where there might be better treatment options.
Great. Well, I want to thank you, Ray, for coming to join me today as co-host for this show.
Pleasure.
And I want to thank you both for sharing your knowledge and expertise and certainly our previous guests on the show today. I think we've talked a lot about cancer and the supports and services that are provided through Trillium Health Partners and our community partners as well. So thanks for joining our show today, and join us next time on Talk Trillium, Partnering for Patients.